Hi, I'm Dr. Brian Jarvis. I'm an orthopedic surgeon here at Arnot Ogden Medical Center. I studied undergrad at Michigan State University. I went to medical school at the Lake Erie College of Osteopathic Medicine. I completed my residency in Erie, Pennsylvania, and have slowly made my way out east here to Elmira, New York, where I practice general orthopedics. So as an orthopedic surgeon, our main focus is treating musculoskeletal injuries. So that ranges anywhere from just your simple sprains and strains to broken bones from trauma, or even your sports-related injuries. So as I'm sure a lot of people have heard of, tearing muscles or ligaments in the shoulder, as well as tearing ligaments in the knee. A typical day for us, can consist from either being in the OR or being in the office. We work a lot with physical therapists, nurse practitioners, as well as the nursing staff in the hospital and in the office, where we can evaluate you, get x-rays, order tests such as MRIs or CT scans, to evaluate the conditions or problems that you may have, whether that's again a sprain, strain, or arthritis, or even a broken bone. We offer a sports medicine clinic on Monday evenings where local patients from the local high schools, or even just the weekend warriors, can come in and be seen and evaluated by myself. So the first thing we would do is, obviously we want to know how the injury occurred. Then we at the very basic level, we would get x-rays to evaluate that. As an orthopedic surgeon, we enjoy doing surgery, but not everything that we see in practice necessarily needs surgery. So by evaluating the x-rays or obtaining further studies to really see what is going on, we make that decision at that time, whether or not surgery is warranted. If it is, we usually, with any sort of trauma or fracture, get that in as soon as possible, because especially in the hockey community or sports in general, we want to get you back as soon as possible. Certainly, I think anytime that if you're not feeling comfortable, or if you're having pain, that's certainly your body telling you that something's wrong, and I think it's perfectly appropriate to come in and be evaluated. Again, it could be something as simple as an overuse type injury, or something more serious that could warrant further evaluation or even surgery. So I think, as a physician, our job is to make our patients feel comfortable with the care that we are providing. I certainly, would do my best to make, all patients feel comfortable explaining their injury, making sure to listen, what is actually going on, so that we can provide the best and best care for them, and make them feel comfortable with the decision-making plan, as well as being treated and throughout. So being at Arnot, I've noticed that I have a whole group of colleagues that I've been very lucky to work with. That is probably one of the best groups I've ever been around and been with. We are all very up to date with latest medical knowledge. We consistently meet, discuss things, and all of my group has just been a wonderful experience. I've had the opportunity to work with a lot of other physicians in other states and elsewhere, and this has really just felt like home. My wife and children are all here with me. They've all been out and really enjoy the area, as well as myself. And I just think that I'm a very lucky individual to be a part of Arnot Health and my Arnot orthopedic colleagues.